All right, we're going to do some basic examination procedures for wrist flexion and extension with the forearm position in the neutral position. The reason that I'm choosing to show you this is in clinical practice, if there's been any type of serious forearm fracture of the radius or the ulna, oftentimes patients are not comfortable, nor can they get into a fully supinated or a fully pronated position to apply your basic examination procedures. So you do the best that you can in terms of your measurement and basic examination procedures, trying to keep the patient supported and as comfortable as possible with a forearm in neutral. So Hannah, let's see this motion here. Call that flexion. Visual analysis shows good motion on this side, limited motion on this side. Okay? If the movement is limited, do your best with an axis pretty much through the scaphoid bone and follow the second ray and get a measurement for flexion. We want to focus the majority of our examination procedures at the moment on the radial side of the wrist. So I'm going to deliver an overpressure from the radial side of the hand. If that bothers her, again, we need to clarify where. What's the location, the character, the intensity of that discomfort. Okay? Let's study the end feel. Multiple repetitions of flexion. If that's a firm, early end feel, and the patient is feeling tightness, stiffness in the area of the general wrist capsule, okay, and of course there's capsulo-ligamentous structures between each of the individual carpal bones as well. We'll try to do just a little bit of joint play testing at two key joints here, radioscaphoid, radiolunate. There's a big roll gliding surface at the distal end of the radius, so both scaphoid and lunate have to move on that distal end in order to have good flexion. So I'm going to lightly give a little bit of stabilization to the distal radius. And I'm going to test gliding with a particular emphasis on gliding the scaphoid and then the lunate in a dorsal direction. If gliding is limited, it stops very early, has a very firm end feel, we can assume that there might be some shortening of the capsular structures around those carpal bones.